Alrighty, 5:27 now on your Tuesday morning. Young people who exposed others to suicide attempts are much more likely to attempt suicide themselves. As according to a study published in JAMA, it found that adolescents and young adults who had someone in their social network attempt suicide had a higher risk of depression and suicide attempts. Researchers say that the findings suggest looking at whether a young person has exposed to a suicide attempt in their life could help identify other risks or others that is at risk for taking their own life. Exposure to insecticides is not linked to autism or social communication problems. An NYU Langone health study found that children of expecting mothers who had been exposed to agricultural insecticides at low levels, did not have higher rates of autism. The study's authors say this does not mean that the pesticides are safe. They could still harm the developing brain at higher exposures. Young people exposed to ads for alcohol are more likely to drink. That's according to a study published in JAMA. It found that alcohol marketing, especially in TV ads, led to more drinking and binge drinking among young people. Researchers note that young people are often exposed to ads for alcohol when they are watching sporting events. An estimated 42% of Americans over the age of 55 will eventually develop dementia. That's according to researchers at the National Institute of Health. And while most people probably know prioritizing brain health is critical, experts say many may not know how to do that. Mandy Gaither has 5 daily habits you can do right now, regardless of your age, that doctors say can help protect your brain.
For years, Linda Barber helped her mother care for her father and his cognitive decline.
He hid it from us for a long time.
After his death, Barber says genetic testing showed she too was at high risk of developing Alzheimer's disease, and her concern then turned to her own child.
I want to be around and cognitive for my son.
That's how Barber met Dr. Douglas Shari, a neurologist with the Ohio State University Wexner Medical Center. She learned 5 daily habits that can protect the brain and slow the progression of cognitive decline, regardless of age or family history.
Use it or lose it. It's very much true for the brain.
First, Shari says to get physical exercise. It's not only good for your heart and muscles, but moving your body boosts your brain. Next, do mental exercises. Keep your brain stimulated. Shari says to do that through puzzles and games and by staying social. Get off your phone and away from the television and engage in conversation. Third, maintain good nutrition. He recommends a Mediterranean diet with lots of fruits and vegetables and limiting red meats and processed sugars. Fourth, prioritize quality sleep. Keep bedtime routines and treat conditions like sleep apnea and high blood pressure to ensure you're getting those good Z's. And finally, reduce stress levels. That can include managing mental health conditions like depression and anxiety.
If I can keep my cognitive going, then I'm going to be able to still have an enriched life.
For Health Minute, I'm Mandy Gaither.
All good tips there. Dr. Sheriff also says that there are also new medications for Alzheimer's that can help daily symptoms or delay the symptoms, that is, of that disease, but only if a patient identifies cognitive issues early. So he says if there's family history, doing those brain healthy habits daily and starting medicine early can prolong the health of the brain.